So I'm going to pivot to a question that you can answer. This relates...
I can answer that one, too.
No, I know, but I have 43 seconds, and no one has talked about our native populations. When you look at our health statistics, whether it's Alaska Natives or whether it is American Indians, our health statistics in this country, you know very well, because we talked about them, are not where they need to be. And it's in all categories. It's infectious disease, it's tuberculosis, it's hep C, it's mental health, it's depression, it's substance use, it's sexually transmitted diseases, it's hypertension, stroke. It is so deep, and it is so challenging, and it is so hard. You have received support from Native American tribes. You have been in these areas. You have been quoted, and I'd like for your comment on this, as quoted saying, as far as budgeting for Indian country, you said you would immediately triple the budget to support tribes. Can you expand on this pledge and the commitment? Because this is an area where we have truly left our Native people behind when it comes to their health and their health outcomes.
Yeah, thank you, Senator. And you know, this is an issue, as you and I talked about, that is very important. It's always been a priority for me. I spent 20% of my career working on Native issues. I was one of the founding editors of Indian Country Today, which is the biggest Indian newspaper. My father and uncle, Ted Kennedy, my father, were deeply, deeply critical of the functioning of the Indian Health Service back in 1968 to 1980, and nothing's changed. Nothing's gotten better. I'm going to bring in a Native at the Assistant Secretary level. I'd like to get him actually designated as a Assistant Secretary for the first time in American history. Make sure that all of the decisions that we make in our agency are conscious of their impacts on the First Nations. I've spent a lot of time in your state. It's my favorite place to go. I've been up with the Gwich'in, representing the Gwich'in people up in Arctic Village, and been all over the state in the remote areas. I understand in Alaska the unique needs of Alaska because of remote health care, because some of these areas are not even accessible except for airplane. That they don't have ambulance services, that the federal government needs to pay attention to financing transportation, the unusual ways that are required there, and that we really need to focus on telemedicine and AI. Make sure that even in remote places in Alaska, that Native people can get high-quality health care, and we can do that today. And I look forward to working with you on those issues and others.
Thank you, Mr. Chairman.
Senator Murkowski sets the record for going over. Senator also Brooks.